We'll continue with our study of the Radiology chapter in the CPT codebook. This is part 2, and this is built upon the Chapter 5 review that's at the end of your chapter in the textbook. Number 2, an MRI of the cervical spine with contrast. MRI is performed at an independent facility that sends the images to an independent radiologist who will read and write a report of the findings. So if you are coding for the radiologist, you're going to use the 26 modifier. So in this screenshot I've shown you, I've underlined what tells you that modifier 26 is needed, and you're coding for the radiologist, that's in green. Your MRI of the spine, when you investigate the different code descriptions that are given in the index, you select 72142 and add a modifier 26 if you're billing for the radiologist. And this is a screenshot from the code book showing you this code. This is an example not in the textbook that you will see on the exam for this chapter, so pay attention. A patient undergoes a retrograde urethrocytography. The same physician performs both the injection and the supervision and interpretation. What's the correct code assignment for the physician? When you read through the index, you look up urethrocytography, retrograde, which are the terms given in your procedure. This gives you only the injection code, 51610. Remember in our part 1 of this chapter, the part 1 podcast, I reminded you that when you have a procedure ending in GRAPHY, oftentimes an injection is used to accomplish the examination. And when you get to the 51610 code, you're going to read around that, the guidelines around that code, and you do find one, 74450, for radiological supervision and interpretation. You must have both codes to code this procedure. You will see this example on your exam for radiology. Please pay attention. And here you have this particular code, also adding the guideline under it, in this case, under the code, for radiological supervision and interpretation, use this code. For radiological supervision and interpretation, use 74450. And this is the 74450, telling you it is the urethrocytography retrograde, but only for the radiological supervision and interpretation. Number 4, CAT scan of the abdomen with contrast and the pelvis without contrast for the same session. CAT scan with and without contrast for the abdomen is 74178. You can blow this up. And when you blow it up, 74178, you notice in this family of codes at the very top, abdomen and pelvis. So this particular code description tells you are coding both. The code covers both parts of the body. Number 6, intracavitary placement of 4 radio element sources. This example is a little tricky, and I wanted to walk you through the steps of why it's tricky and how, if you were coding from an entire record, it wouldn't be as tricky. But because we are pulling phrases or sentences out of a complete record, it does get tricky when you are selecting codes. But if you look at this intracavitary placement of 4 radio element sources and go with radio element as your main term, that takes you into these codes, and when you look up 31643, that's a bronchoscopy code. Well, we are coding in the radiology chapter, so what the coder would do is go back to the record to see if you can find more information that would help you select a radiology code. And when you go back to the record, you would find that this intracavitary placement is being accomplished for the purpose of clinical brachytherapy. So once the coder knows that from the information in the record, then you would start with brachytherapy as your main term instead of the radio element. I think it's tricky for this to be in a textbook because the coding student does not have benefit of the entire record. But if you were in the field, you would have benefit of the entire record to review to help you know which code families you should be looking at. When we go to the code book, you see this is this family here. It is important to note that the number of sources for the clinical brachytherapy is how you're differentiating these codes. And in this particular case, it told us 4. Go back to the scenario here. 4 radio element sources. So that is what's going to drive your selection of the first code. Number 8, a pelvic ultrasound pregnant uterus, transvaginal. Transvaginal is the approach to the uterus. Transvaginal just means through the vagina, you're getting to the uterus. You can also, of course, ultrasound the uterus from the outside, the different approach. But this particular procedure is being done transvaginally, so we should have a code that describes that. And when we look up all of this range of codes here from the index, we do find the one that says transvaginal. Let me blow this up. 76817, transvaginal is part of the code description. You notice that both columns at the top I have written OB or obstetrical because both columns in this particular page of the CPT book are the ultrasound of the pregnant uterus. Whole body bone marrow scan. Now the textbook has added in parentheses nuclear medicine so that you know where you're searching for codes. Without the benefit of the entire medical record, I think it's really hard to select the right code. But the authors in this case are telling you it's in the nuclear medicine chapter. So if you go into bone marrow as your main term, nuclear medicine imaging, you get this group of codes. And when we go to our codes, we're looking for whole body. Let's blow this up. And you see there is a code description, 78104, for whole body. And also note that the bone marrow falls under the hematopoietic, reticuloendothelial, and lymphatic system. It's important to know, this is back to your anatomy that we've often talked about in this course, that your bone marrow would fall into this system. Number 12, gastric emptying imaging study, also in nuclear medicine, with small bowel transit. Here's the correct code. And here it is in the code book. Let's blow it up. And you notice that one of the code descriptions says, with small bowel transit. There is no getting away from all the reading that has to be done in this course. You have to read all these various code descriptions to select the right code. And needless to say, you can't do it quickly. But if you've highlighted the phrases in the code families like this, I really think it helps you find it a lot easier. A renal scan with a vascular flow and function study without pharmacologic intervention. Comes under your kidney, nuclear medicine, imaging. When we read those code descriptions, we get to the right one. You see, I have written at the top of the genitourinary system nuclear med diagnostic, which just came from the previous pages in the CPT book. And we do have the study without pharmacological intervention. The code below it is with pharmacological intervention. How many times in CPT the only difference in two codes are the terms without and with? Very often. Myocardial perfusion, or a SPECT study, performed at rest. We're just going to look up myocardium perfusion imaging, and our code tells us it is at rest. I've written at the top of the page, cardiovascular system. That was taken from the previous page's far right column. Ultrasound guidance for retrieval of ova. There's your code. And here it is in the code book, specific to the retrieval of ova. Aspiration of ova is how it's described. Patient is known to have a mass in the temporal retina. A diagnostic ophthalmic B-scan ultrasound is performed along with a quantitative A-scan. This is another tricky one that the authors have placed in the textbook. I just want to walk through it, explain why it's tricky. If you strictly went by the main term ophthalmology, diagnostic ultrasound in this range of codes, and you read through all the code descriptions in this range of codes, nothing says B-scan and quantitative A-scan. So if you don't find a code that matches the procedure that you are trying to code, you go back to the index, you find other codes, and if you search under ultrasound of the eye, you do find a different code set, and one of those codes, 76510, does include B-scan and quantitative A-scan. So if we look here in these codes, blow it up, here B-scan and quantitative A-scan, right there. Now let's look at some x-rays. An AP of pelvis and left hip. There's two views that are given, one of the pelvis, one of the left hip. We're going to assume that you're billing for a facility that's providing both the equipment and the radiologist. But don't forget there will be a modifier because of that left hip. So whatever code you choose, you will have an LT modifier to signify the left side of the body. When we look up our x-rays, there's a range of codes given. There are two views. The procedure tells us there's a pelvis and a left hip. So 73502 would be our code. Blow this up. And you see the lower extremity x-rays are by views. We have two views, so we would choose 73502. This chest x-ray, also two views, PA view in the lateral, and there is the code. And here it is in the code book. Two views, 71020. If you have any questions about Chapter 5, Part 2, please post them in the discussion board along with the path you use to try and find your code, and I will do my best to answer them. Thank you so much and have a good day.